standard. So I think that's what we'll focus today. Then the last on the content, we'll just look at some key takeaways, which will be very, very important to us as a professional and also as an individual. So going forward, just like I said, we have to go slowly so that others can join us. Okay, now let's look at the importance of managing good air quality. You know, as a professional and as an individual, because I will keep emphasizing as a professional and as an individual, because the topic focus on workplace, and at the same time, we are all health and safety practitioners. So there are a lot we can take in to share within our organization. And also, like I say, hey, you cannot do it within your workplace and forget to do certain things in our respective home, because this is a factor. These are pollutants that it's everywhere. It's in the air. Okay, so it is very important that it cuts across all area. While they might be doing some kind of excavation at the workplace, possibly you might not be doing, there might not be or excavation activity at your own home or house. So, but when we discuss a topic like this, we need to marry it together so that we all can benefit from both angles, irrespective of the workplace. So when we look at the benefits in terms of health, okay, when we maintain and manage good air quality, good air quality, it tends to improve, you know, our health as well, because when you improve the air quality, this can reduce respiratory issues, allergies, and other health problems of employees. Okay, I will give an example, a scenario. That is why even if our respective home, you see a lot of people using humidifier and all that. I think one of the discussion we did some time ago, I make emphasis on this, because, you know, and especially children that are born these days, they are highly sensitive, you know, when it comes to allergy reaction, you know, unlike especially maybe those born in Qatar or some other country. But I know from those of us in Africa, but so many things happen even in Africa that we just ignore. But sometimes these things are related to poor air quality. Okay, so it's a public health issue and it's of public health concern, because most of the respiratory issues that we see, because when somebody get cough, for example, you know, he got flu, is because the air became contaminated either with organisms or some other forms of pollutants. And this pollutant could ranges from bacteria, virus, it can be chemical, could I just say biological and chemical? You know, when we're talking about kosh and all that, you know, these are substances that are hazardous to earth, because this thing pass through the respiratory tract. Okay, so when we talk about health benefit, it's very, very important that we look at air quality issues within our workplace. Okay, so when we look at another importance of maintaining good air quality, one good reason is for regulatory compliance, you know, because as an health and safety practitioner, we should all know that for every topic, for every related issues within the health and safety space, there is always a regulations, you know, or guidelines that are used, you know, or that are written for people to follow and comply in order for us to have a productive work environment, in order for our employees to be well protected at the workplace. So when we talk about regulatory compliance, it's all about maintaining air quality standards. It's about maintaining that air quality with respect to standards that are being implemented or that are being put across to everybody to apply within their respective industry. Okay, so and it could range from international and local regulations. And in most cases, most of the national local level, they take most of their local regulation from the international um, um, regulation as well. Because when you see some country standard or regulations locally, you see it is either it is adopted from the international, um, from the ILO, from the I think yeah ILO, either from OSHA, from the Health and Safety Executive, a lot of regulatory standard across the world. Um, People have to bring it and look at some difference, look at what your environment, because a country that is likely to expose to more of air quality issues. So there are so many things they need to look at, within such country. Because for example, now in Qatar, we know this is a Gulf region. This area of high maybe summer period and all that. So a lot of time the weather changes, and once the weather changes, it comes with a lot of dust and all that, and the air is being contaminated. And most of the time, you see, even as at 2 days ago, I was with my son in fact, for the past 3 weeks, I've taken him to hospital like 3 times because he goes to school, he get infected and come back. So these are the things we are talking about. So they are very, very important. Apart from the air pollutant we can just get from a public setting, when we get to the workplace, particularly, like the activity we do that expose us to all these things, so or the workers. So these are things we need to look at, and also a productivity boost, because when you have a well-maintained good air quality within your workplace, you discover that you have a kind of enhanced productivity, because there will not be lost time, there will not be absence from work, because when your workers are healthy, people will not absent from work, okay? Because when people are sick, it now. When somebody gets infected today, the next day is out of work, the other person gets infected, is out of work. So it's very important that all those things are probably looked into in order to have a productivity boost or enhancement within our workplace. Sometimes these are things we need to discuss with the management. We need to prove to them that this is how it is. Like I will give for instance, I had some issue in our site regarding one PPE. I think safety shoe to be precisely. So there was a time they bought. I recommended a safety shoe which they refused to go for because they feel is too expensive. Then I left them. I gave them advice. I brought this argument as at that time. Then recently there are some issues, some changes need to be made. Now this safety shoe they bought, is just a bit different from what we are saying here, but I want to give us how sometime we can prove to our management. Now I told them maybe this safety shoe they bought, according to the technicians, they said maybe this safety shoe they are selling it like maybe 40 real, 45 real. As compared to buying some at least mid-standard, we'll talk about 80 reals here in Qatar, between 80 reals to 120, good quality that can last you up to a year. Now this one they bought, you see some people within 3 months, 4 months, at least maximum of 6 months, the safety shoe got spoiled. Now, today, I was talking to my FM manager, because they need to get another safety shoe for the guys. So they have to prepare the list, the admin have to prepare the list and all that. So I came into the picture. This is where I need to come in. So we started discussing. I started saying, the company doesn't. I said, see, this is logical and it is practical. I gave you an example of the past event that happened. I said, see, it is just practical. When you have a good safety shoe, you discover that within a year with low quality, in less than 6 months, you have to replace again. People will start complaining their safety shoes is not good. It has damage. Okay, so it is just practical, except the management don't want to think practically. Because when you buy cheap, at the end of the day, you end up spending more than you just getting a quality. Because when you talk about quality, the word quality cannot be overemphasized in anything in our life. Good quality health, here we are talking about air quality. So even with the PPE, when we have a good quality, it lasts longer. That is the reality. So I just try to chip in this one for us to understand how we can convince management. It might not have happened in your organization, but you can bring what I've just said, you can bring it as a scenario. Because in most cases, you might not experience it in your organization, but you have to bring a scenario. It's just like when you do in the bush, you see the way they do in the bush these days, it come in a scenario way. So you have to create something, even if it has not existed before, just create it as a point for you to to channel your point to the management and to be able to convince them. Now, we're going to look at the common indoor air pollutant, like the common the carbon monoxide, which is odorless, colorless gas from burning equipment. You know, especially in the site, they use a lot of machinery or equipment, even vehicles, and some other activity that are being done on the site that could probably generate CO2 and thereabout. And previously we were discussing about environmental issues, you know, how the earth is being polluted. You know, here we're talking about global warming and all that. You see that a lot of countries, you know, are trying to reduce their carbon print. And for those of us who are here in Qatar, we really understand what the government of Qatar is really doing to reduce their carbon footprint within this country. And when you look at their public transport system, I believe by 2030, their public transport system will be fully um, um, electric. Even as we speak today, they are among the best in the world in terms of electric vehicle, in terms of public transportation, because when we talk about public transportation, we know how much such kind of system can generate in terms of carbon footprint. So it is very important that in many ways, in any ways, we could reduce carbon footprint, you know, as part of environmental management and sustainability. I think it's going to go a long way. Apart from talking about air pollutant, or maybe probably in terms of quality of air to an individual, even within the earth itself, within the ozone layer, we know how the effect is, you know. So, and I could remember during the time of COVID, because in Qatar, they were even monitoring their carbon emission during the time of COVID, because there were less restriction and a lot of things. So even as at that time, Qatar recorded a lot of, you know, good air quality within that time, you know, during the time of COVID, because there were a lot of restriction and all that. So because I attended a webinar by one of the Ahmad bin Khalifa University, you know, there were a lot of research that was done about it, you know, because there were less vehicle on the road, there were a lot of things, you know, were reduced. So there was this drastically reduction, you know, of the carbon and some air pollutant within the environment. And also they tried to look at some activity that was done prior to the World Cup, you know, how they were able to measure, you know, how many the CO2 that was generated during construction work, because definitely during construction work, a lot of these things are being generated also as well. So basically, as much as possible as we can manage, we should be able to manage all these things, all these pollutants within our environment. And also the number 2 point is we have also what we call the volatile organic compounds, you know, which are chemicals that are emitted from probably like paint, cleaning products, and furniture. You know, when you look at a lot of painting activity, you can see that in construction. Even in some existing facility, you see you use a lot of cleaning chemicals, especially in the offices, even in our homes and all that. So most of these things they are things that when they are being emitted into the atmosphere, they tend to contaminate the air and become a pollutant to the air. And also, when we look at some furniture activity, some kind of wood work activity, you know, so it's also a pollutant, you know. In some cases, you discover that, oh, it's only those people who are doing the work, who are working on the wood, that are only probably affected by this wood dust or whatever. Because the same way silica dust that you can get from cement and all those things, the same way wood dust can also affect the respiratory system. In an advanced case, it can lead to cancer also. So these are very, very important issues, because when we try to manage and reduce this process, it tends to prevent this let's say compound going into the atmosphere, mixing with the air and all that. So sometimes it is not, like I've said, it's not only those who are working there, you know, even once you contaminate the airspace, other people who work close to that activity can inhale it. Even as far as away from the activity can also inhale it, because the dust of the furniture, woodwork is already in the air. So people can inhale it just like people who are secondary smokers and all that. So all these things are really issues, and there are problems that we need to look at critically and find a way to manage them in the work site. We know that if such kind of activity is happening, we know how to introduce a ventilating system in terms of engineering control, how to use PP and all that. So basically, another issue is that the particulate matter, like there are some tiny airborne particles from dust. Yeah, generally dust that will get within the environment, within the construction activity. We know how construction activity generates a lot of dust. You know, in some cases, if in industrial, it generates smokes, and so many other sources that can bring about this particulate matter that at the end of the day it goes into the atmosphere and people start breathing in and all that. Like I said earlier, you know, we have a lot of biological contaminants, you know, like mold, bacteria, virus, you know, that can thrive in a damp environment, you know, an environment that is kind of humid or damps and all that. So that is why you see in a country like West Africa that have this rainforest and all those areas, you discover that people are more prone to all those bacterial contaminants, you know, unlike those areas like the Middle East, the desert, you know, but the desert area is all about more of particulate matter, you know, carbon monoxide and some other volatile organic compound that we most frequently see in this area. Now, we have to look at also like factor affecting workplace air quality. You know, most importantly, when we look at the design of building, it's also a very big factor. You know, there's this, we need to provide what we call a kind of proper ventilation, temperature, and humidity control system, because it is very crucial and important that such things are being done in the design of building, as there should be a provision. That is why even in Qatar here, for you to get approval for building and all those things, you need to get approval from the civil defense. So a lot of things we need to be looked into. You know, like when you come to Qatar or the Middle East, you see in the bathroom, kitchen, and all those things, you see a lot of these ventilation fans, which only few homes or more advanced homes in probably Africa, where we come from, you see people putting these things because they've gone abroad, they've seen how things are done in terms of building design, so they are introducing it. But when you look at the traditional building those days, you know, in the African part of the world, they don't do those things because probably um, the African region is not like a desert, because in this desert area, in fact, you cannot just joke with ventilation system, you know, even if we can avoid that in the African setting. So it's very important. Every space, you know, it's very important that we have ventilation system, because if you don't do it, even from the AC, we get poor air coming into the room. And if it doesn't have a way of taking it out, you know, everybody get infected within that room, and they will begin to come up with respiratory issues, most especially. And also occupancy, in terms of high occupancy level, can increase the concentration of air pollutants, which is absolutely correct. I will just, in order not to waste that, I think during the time of COVID, we could see why they introduced globally for people to reduce the number of people working in the office. You know, at some point, as part of the strategy to reduce the spread of infection, because when the people are more in the office space, it becomes more concentrated with when you mix with somebody who is affected with such thing and all that. So that is why it's very important when you have too much occupancy, the design of such kind of building that will carry a lot of occupancy will be properly designed to take care of all this system, of all these issues rather, you know, in order to reduce the chances of people getting infected in terms of pollutant from the air. Now, also, we have to look at workplace activity. You know, like I've said, we need to put more concentration on this area, because as health and safety practitioner, we are talking about the workplace, a lot of activity, you know, that can create air quality issues. You know, like I've mentioned about woodwork, even some kind of grinding work in terms of bricks and all that, sand activities, cement and all those things, they end up in the air. Okay, so there are some other activity like printing, painting, all these things, cleaning surfaces and all this, they use chemical, they use some kind of compound that you just think they are not being emitted, but in reality, they are emitted to the atmosphere somehow, either within the space of the office or within the space of our workplace. So, and once these things are released, these substances are released, they become toxic to the air, because at the end of the day, we are the receiving end because we have to breathe in oxygen. So at the end of the day, we take part of these contaminant substances or pollutants into our respiratory system, because that is the first point of contact, and the way these compound or substances are, sometimes when they go in at the upper respiratory tract, they cause some kind of allergy reaction, so at that level. But most of all these chemical substances, when they are more tinier in nature, they will be able to pass and get into the alveoli of the lungs and get attached to the alveoli, and then that is why most of these things they end up causing cancers and all that, because when lung cancer, because when they get being attached to the alveoli, there will be some reaction. Normally, naturally, the alveoli is supposed to engulf and all those things to fight these substances. But now, depending on the nature of these substances, some of them are so radical that the system within the lungs cannot be able to break down this compound or substances. So they end up forming some kind of crystal-like scars, causing a scars within the lung tissues, and someone will begin to generate respiratory issue within the lower respiratory tract or respiratory system rather. So it is very important that we deploy all necessary procedure to manage and improve our air quality within our workplaces. And also, when we look at strategy for improving air quality, we need to look at source control. And as a safety practitioner, we all know that sometimes when we talk about all these related issues, that has to do with generating dust and all that, I think the first point of contact, we have to look at the source. Where is this thing coming from? Part of the control measure is to look at how we can eliminate this thing completely. If you cannot eliminate, you need to look at substitution, engineering, administrative, and PPE and all that. So it's very important that sometimes it is best to control such issues, from the source that is being generated. Because if you don't put your focus on the source and you're trying to control it at the middle, you discover that you're creating an opportunity from the source. It goes out, it goes to the atmosphere. Then at the middle, you're trying to prevent it to go further. So it's not the best way to control at that level. If as much as possible, we can control from the source, from the source of this pollutant, it is best to do that, except otherwise, okay, because it helps reduce such pollutants being released to the atmosphere. And also, when we talk about the ventilation system, like I've said earlier, we need to provide a kind of or ensure that there's adequate airflow, ventilation in and out, not just one way. Something comes in, there's no way to go. That's when we talk about cross ventilation. It is very important for us to have a cross ventilation, because if there's no cross ventilation, once the air comes in, it becomes contaminated. It will create a lot of health issues. But when it goes out, when there's a system that takes the air out, at least it can reduce probably the number of air particles or bacteria, anything that have contaminated the air. And also in some ventilation system have a kind of filtration system, that can trap and remove also the contaminants within the airspace. So it is very important, like when we talk about that, the HVAC system that they use, the kind of air conditioning system that is used in maybe like in a commercial building, in the towers and all that. In some individual, when people design, they use the HVAC system. Is very, very important, because they will treat the water, the chillers and all those things. So it's very important, because those things helped. Because you cannot go to Qatar in a public place, you just see normal kind of AC. is HVAC system. You know, in an advanced country, you see all those things, and they treat all those things for us to have good air quality. Because any system that is not well maintained or treated, you cannot get good air quality within such space or environment. So, and also air purification. Like I said, you know, in some homes, you have this air purifier, or I think, yeah, they call it air purifier. I think I have one like that in my home. And this purifier has a special filter inside, and this filter are called HEPA filters. They are very, very important because they help to trap, you know, to capture any air pollutant. That is why people are staying in an environment whereby it's highly polluted with dust, a lot of things like that. You see them, it's either they have allergy reaction, you know, most times they sneeze and all that. And naturally, some people have allergy on their own. And being exposed to this kind of air, poor quality, they tends to react to it also. Because even my son is very sensitive to all these things. So that's why I even have a purifier in my room as well. So all these things are things we should take very seriously and of concern. And also, it is very important when we talk about workplace, we cannot just do this without educating our workers. They need to be informed, you know, about air quality issues, and encourage them to involve in good practices, you know, because this will help to enhance the quality and have a good health workers within our workspace. And also, when we talk about monitoring and measuring of air quality, we need to look at maintain a comfortable temperature, you know, temperature range, you know, to avoid discomfort and health-related issues. Also, when it comes to humidity, proper humidity level prevents the growth of mold and bacteria. So it is very good, it is very important, especially in our home and offices, to maintain that proper humidity level, you know, as recommended. And also, we need to look at air quality monitoring. Air quality monitoring. You see that in some organization they have a sensor, you know, they have a sensor that are being used to monitor air and track air pollutant level, you know, in order to identify or determine which area that is more contaminated and all that. So people who are into environmental also, they focus on air quality monitoring. Okay, these are aspects of environmental health. Okay, so when we look at ventilation efficiency, like I've said earlier, we ensure that the HVAC system are properly maintained and functioning properly. Because if the HVAC system is not well maintained, there will be a problem. Because like for me, we work in a facility, part of our project as an MEP contractor, these are what we do. We maintain the HVAC system for the facility. So we look at the chiller readings, you look at all those things. There are parameters you need to look at to change the water, purify the waters and all those things. So it's another topic on its own. So all these things they use to control, monitor and measure the air quality, because from the readings and others, you can really determine if the quality of air is good or not. So going further, we'll just try to look at some regulation within the United States. As we all know, OSHA is Occupational Health and Safety Administration, which set limit for workplace air pollutants. They have standard that sets such limits which individuals should be exposed to. But for the purpose of this discussion, I don't want to go into deep for the purpose of time as well. So we have the American Society of Heating, Refrigerating, and Air Conditioning Engineers. They provide some kind of guidelines for indoor air quality as well. Then we also know about the EPA, which is the Environmental Protection Agency in the United States. Also, they regulate air quality standard for outdoor and indoor environment. Sorry, and also I also like to give us this takeaway in terms of conclusion as well. We need to prioritize our air quality by maintaining good workplace air quality, you know, because it is essential for employee health. It is essential for productivity and compliance to regulatory standard. And also it is very important, like I've said earlier, for us to implement strategies because this strategy will help us to be able to kind of utilize a combination of different source control in terms of source control, ventilation, air purification, and also employee education, like I've said earlier. And also monitoring and measurement is very, very important, because when we do this, it means we are doing what we call active monitoring. We don't need to be doing reactive monitoring after issues have started arising as a result of failure of good health quality. I want to say thank you for giving me this opportunity to give this few slides of my presentation. I think I would like to hang on back to Mr. Johnson to carry on from here. Thank you very much.
Thank you very much, Mr. Stephen, for that wonderful presentation. As usual, we know we can always count on you. So, dear comrades, we appreciate your presence, and Mr. Stephen has done the entire groundwork. So I just want to add few things, a few points that I've prepared with us. All right, so he has talked more about the importance of air quality, and he also went some steps into the procedures or the systems for measuring air quality. So, like he rightly said, air quality simply refers to the suitability of the air, or how clean enough the air inside the environment is for human consumption. So this is not just applicable to the workplace, it's also applicable to our homes, just like he has rightly said. So I'll be talking more about the importance of air quality index, or the rating. So like he has mentioned that the air pollutants could be in form of carbon monoxide or sulfur dioxide or nitrogen or some ground level ozones. So there is what is referred to as air quality index. So this is the level of air quality in a specific area. How we're able to communicate it. Most times it's measured from 0 to 500. So if you measure the air quality and you have a value between 0 to 50, we consider that air quality as a considerably satisfactory with no health risk. So, but when you have a value between 50 to 100 air quality index, we say that the air quality in that environment is acceptable. But however, there are some risk factors that could affect certain people, especially people who have some terminal illness, or people maybe minors or children. Then when we have a value between 101 to 150 air quality index, we say that air quality in that environment is unhealthy, and is very is unhealthy for some sensitive groups, such as maybe people suffering from respiratory tract infections. So that's such type of air quality index is not good for them. Now, if the value is between 151 to 200 air quality index, so that air quality in that environment is unhealthy, and everyone in that environment would react to it. So if the value is between 201 to 300, then it's very unhealthy. It's a health alert. So there are so many serious ill health, especially respiratory tract infections, that are bound to occur in that environment. Almost everyone in that environment will get sick. So the hazardous air quality index is between 301 to 500 air quality index. So at this rate, is a health warning and there is an emergency situation, and the entire population in that environment is likely to be affected. So the reason why we are talking about air quality index is when the environmentalists or people in your workplace measure the air quality, and when they send out the readings or their findings to the management and you are CC'd in the email, it's good that you know what these values mean and you don't just keep quiet, especially when you see values that are very unhealthy or hazardous air quality index. So that is why I decided to bring up these readings and what they mean. Okay, now we have very important the reasons why the workplace air quality should be healthy enough or should be pure enough. And one of them is the health. Mr. Stephen has talked more about it. And
Unmute yourself. I think you muted yourself, Mr. Johnson.
okay, so the importance of air quality, Mr. Stephen has said much about this in health, productivity, comfort, and it's also a form of legal compliance that he has said that there are some legal requirements and regulations that require that air quality in that environment should be maintained to a certain level and certain degree. So to ensure good air quality in the workplace means complying to that legal requirement. So the other thing I want to talk about are common pollutants in the workplace. The particulate matters, he has dwelled more on that. The ozone, he has also talked about that. Carbon monoxide, nitrogen dioxide, sulfur dioxide. So these are common pollutants in the workplace. And these are what could make the air quality unhealthy and make the air quality unacceptable. So the other thing I want to dwell more about is the health effect of poor air quality. Respiratory issues is the most likely. Then there is probability of cardiovascular problems, heart diseases. This could also result, be seen as a result of poor air quality. Lung diseases as well. Neurological diseases could also arise from poor air quality. Eye irritation, this is most likely that you see it in your workplaces. If the air is full of dust, you see that you'll be having some eye irritations. So these are some of the, now let's look at some of those methods of measuring the air quality. Mr. Stephen has talked about some of them. The first one is the monitoring stations. So in an environment where there are constant release of air pollutants, the workplace or the employer is likely to install a monitoring station, which is permanent, and it keeps giving the readings and information about the air quality in that location. There is another device for measuring the particulate matter. So this is another device that tries to assimilate the air in that environment and an attempt to measure the concentration and find the ranges of the particulate in that, the size of the particulate in that environment. And this will help to determine if the air quality in that environment is healthy enough or is bad. There is also gas analyzer and sensors, so which is used to identify if certain types of gases are present in that environment and the quantity that is present in the environment. The other type of Other ways of measuring air quality in the workplace includes the air quality indices, remote sensing and satellite data. There are some data that are being collected from the satellite, which could be tabulated and be able to use to determine the air quality in that environment. So what we are talking about is to improve air quality in the workplace, you need to first improve the ventilation, use air purifiers, monitor the air quality using any of the devices or methods that we have listed, control humidity, ensure that the humidity within that workplace is between 30% and 50%. So like Stephen has said, this will help to reduce mold growth in that location, and this will also improve the air quality. So reduce the emission. If there are a lot of concentrations of the contaminants in that workplace, try to reduce the emission of that pollutant in the workplace. Okay, then the other strategies, that maintenance, regular maintenance of that environment or the equipment use, cleanliness, ensure that the environment is cleaned regularly, remove all the chemical products that emit harmful substances in the environment. Then indoor planting, you can also add some indoor plants in your homes or maybe in the offices. This will help to produce a certain level of oxygen inside that office or inside the workplace, which will help also to improve the air quality. Training is very important, letting everybody know what is acceptable and what is not acceptable by means of policy implementation and development, letting people know that certain level of air quality is what is required and must be maintained. So this policy should be implemented and monitored as well. So improving air quality in the workplace is not just for health effects. We have seen the importance that it aids in productivity. If people are ill, if people are sick, then the productivity of the workplace is going to be affected as well. So that is why it's very important for us to work on improving air quality in the workplace. So this is the much I want to contribute, and we have few minutes and others can add to their voice as well. So thank you for listening. So others can add their voice.
Hello. Sorry, my name is Henry. Hello, am I audible?
Yes, you're audible.
Yes, you're audible.
Okay. Thank you, Mr. Steven. Thank you, Mr. Johnson. I think both of you did a very good analysis on the topic today. Where I want to go in is we are talking about air quality, workplace air quality. I want to go to our workers' accommodation. Mr. Steven talked about building design, our building design for, our workers' accommodation. Sometimes I find it, funny the way they, build those kind of rooms without no ventilation going inside. And also the occupancy, the numbers of people or workers in the rooms. I think this is where, management need to, come in also to help in terms of good air qualities for our workers. It's not about training. It's not about, bring all this awareness training. When you do all these things, but when you go back to the building design is shit. The occupancy They will put in how many people in the room, and everybody knows what I'm talking about. So that is where I'm, trying to focus on, workers' accommodation. So I don't know whether you people can also, say something on that area. Thank you.
Thank you very much, Mr. Henry.
Sorry,
That is,
Mr. Sorry, Johnson. Let me attend to it. I thought I omitted myself.
Okay.
I was already speaking, but I never knew that. So is Mr. Henry in Qatar, or in which part of the country is he? Because I have a reason why I'm asking the question. Mr. Henry, where are you presently? Where
I
you're
work in
working?
Qatar, but I'm not in Qatar right now.
Okay,
I work in
okay, okay,
Qatar.
okay, yeah. On this note, I wouldn't know. I wouldn't know who is what kind of project you are running, but we all know that even here in Qatar, we know they have we have law, we have standard, we have regulations that covers the accommodation level. But the problem and challenges is that if your project is probably a private project, probably might not have frequent inspection. I believe that is where I believe the government should put more emphasis, in putting more monitoring on the private project. But I know one thing I know about, if it's an ASGA, a government project, I know very much that they do inspection of accommodation. Okay, there is always a checklist, and when you look at those checklists and everything, you see that it covers such provisions to cater for all these things you've talked about, except maybe the project is not an ASGA project. And probably if it's an ASGA project, then maybe they are just taking their eyes out of it without doing any implementation or inspection from that angle. But for all that I know, and for those of my colleagues who have worked a lot in ASGA project, I know they normally inspect their accommodation. So that is what I have to say.
I will come
Okay,
in there. Our project is Ashigal. Ashigal also goes there to inspect. Ashigal, let's forget about Ashigal. Ashigal, all of them, most of them are Alibaba. Let's be fair. All of them, most of them are Alibaba. They go there, they take what they take, they make their observation, do their recommendation, and during the closeout, we, the company, close, what we want to close. Then the back room, covers everything. So the main people suffering is our workers.
Yeah.
It's our workers suffering.
I understand your point. It's unfortunate that it's happening because for the purpose of public concern, I will not want to mention some names and all that. We know who dominates that area. So I believe they are being complicit about the whole situation, because there are some set of people, when you put in such kind of area, I believe they will do their job very well. We will not experience such kind of thing. Just like I've said, I don't want us to go deep into it so that
okay.
begin to point.
Yeah, thank you, Mr. Stephen, and thank you guys for joining. I have another webinar now for NIDO, so it's already 7 o'clock. So thank you, guys. Next week we'll continue, and maybe we'll have more time to talk more on this issue. So thank you, guys, for joining, and see you next week.
Thank you.
Yes.
Thank you.
Thank you, sir.
Thank you.